Welcome to the Bookman's Corner. I'm Lois Lindstrom. Today we have a very interesting show on a vitally important topic, Obamacare, or the Affordable Care Act, which President Obama signed into law on March 23, 2010. Renamed Obamacare at its conception, the Act's 2,700 pages are filled with government price controls, mandates, subsidies, bureaucracies, and regulations. And now, having escaped being struck down by the Supreme Court, Obamacare is constantly cited by individuals and businesses as too expensive, and there have been numerous bills introduced in Congress to repeal it since 2010. Supporters credit Obamacare with helping 9 million uninsured Americans to find coverage by 2014. Today we'll be discussing health care with guest author Michael Cannon, who co-edited an e-book, Replacing Obamacare, the Cato Institute on Healthcare Reform. Nice to have you here, Michael.
Thanks for having me.
And you are the Director of Health Policy Studies at the Cato Institute and co-author of Healthy Competition, What's Holding Back Healthcare and How to Free It. Your co-editor is Michael Tanner, who is Director of Health and Welfare Studies at the Cato Institute. Michael, your ebook covers and contains work of over a dozen national experts who have dedicated their professional lives to enabling true and effective health care. I'd like to ask the first question in Chapter 2 of your book. Is health care in America a right or a privilege?
Well, really what people are getting at when they ask that question is how do we make health care as widely available as we can? How do we bring it within the reach of people who need it, particularly vulnerable people who don't have the resources to purchase it themselves? And whether we call it a right or a privilege, I really think that's sort of a false dichotomy there. The real question is, what set of public policies is going to make healthcare better and more affordable and more secure, particularly for the most vulnerable, the people we care about the most, the very sick, and those with low incomes who can't afford it themselves. And the problem with declaring that, well, everyone has a right to healthcare, which really just means the government is going to issue a guarantee to make sure that they're going to make it illegal for everyone not to get health care, is that the governments are not very good at delivering on those guarantees. And so you see where governments have issued those guarantees, yes, lots of people get medical care, often medical care that saves their lives, but we're not doing as well as we could because lots of people are falling through the cracks. They either have to wait for medical care and often wait too long. We see that in our own homegrown single-payer system of the Veterans Administration, the Veterans Health Administration. Or you see in the U.S. Medicare program, which covers seniors and the disabled, that even when government throws lots and lots of resources at medical care, people fall through the cracks because they get misdiagnoses, they get uncoordinated care, so the doctors aren't talking to each other, they get too much medical care, harmful medical care, because the way the government pays for, when the government gets involved in the way Medicare does, it blocks a lot of innovations that would help prevent people from falling through those cracks.
Well, let me ask you, is it true that nearly all of the 16 million Americans who are now insured under Obamacare are actually on Medicaid, which gives people free or nearly free insurance?
There's a lot of confusion about how many people are covered now as a result of Obamacare who would not have had coverage otherwise, because a lot of them would have had coverage even if Obamacare never had
existed.
Passed,
okay.
Right? And so you'll hear estimates of between 9 and 16 million people. And
that's a big, vast gap there.
It's quite a range, but generally speaking, most people agree that most of the newly insured people, whether it's 9 million or 16 million, are newly insured through the Medicaid program, because Obamacare had two main ways of trying to expand coverage. One was expanding the Medicaid program, which already existed, funded more than half by the federal government, but funded also by the states and administered by states under federal rules and supervision. And the other major coverage expansion was the so-called health insurance exchanges, where people could get subsidized coverage. And it's unclear how many of the people in the exchanges would have had coverage anyway. It seems like most of them would have.
Under Medicaid?
Well, they would have had private health insurance anyway. There may be some people in the exchanges who would have had Medicaid had Obamacare never been passed. But then there are also people in the Medicaid program who would have had private coverage if Obamacare had never become law.
Well, let me ask you, how much does our country spend annually on health care cost?
It's about 1/6 of U.S. GDP. 1/6 of the entire economy, or about $3.2 trillion per year. And it's headed toward 1/5 of the U.S. economy. And the main reason for that is, first of all, I'm not one who gets upset with the amount that we're spending on healthcare. I don't think that if we were spending 1/5 of the economy on automobiles or computers, then people would decry that, as long as we were getting value for what we're buying.
Exactly.
I think that what's the problem with the fact that we're spending so much on healthcare comes from the fact that we're not getting value for the money that we're spending. We're overspending for a lot of healthcare. We're buying a lot of healthcare that doesn't make patients any healthier or happier, and in fact makes them can threaten their health because medicine is so harmful. So I think that's the real problem there, and it comes from the fact that government has flooded the market for healthcare with so many subsidies.
Okay. Well, how does Obamacare make affordable private insurance available to a broad section of uninsured Americans who are ineligible for Medicaid?
It tries to do that through really through price controls, and then trying to clean up the mess that's made by the price controls that it imposes. The price controls say to insurance companies, you have to charge healthy and sick people of a given age the same premium, even if one of them costs $400,000 a year to insure, the other one costs $5,000 a year. You can only charge them the same premium. And what that does, if that's a $10,000 premium, then what that means is health insurance has gotten very affordable for the $400,000 patient. The price of their premiums has fallen by $390,000. But on the other side of the ledger, the healthy people, their coverage has become less affordable for them. The price has doubled.
Okay.
And that already creates a number of problems. And the rest of Obamacare, or most of the rest of Obamacare, exists to try to mitigate all the problems that those price controls create. The individual mandate exists to force those healthy people to take that bad deal, to buy coverage even though their premiums have doubled. And the subsidies, $1 trillion of subsidies, which, by the way, were not actually in the law.
That came afterwards, right?
Well, because the Obama administration decided that even though the law doesn't authorize those subsidies, it would issue them anyway, even though the law says they can't, and the Supreme Court signed off on that, effectively expanding the law beyond what Congress had the votes to enact. But the idea behind the subsidies is, even if you force people to buy coverage, it's that expensive. A lot of them can't. You have to subsidize them, and that's just on this side of the ledger. On the other side of the ledger, Obamacare has to do a lot of things to try to keep insurance companies from avoiding those $400,000 patients who are really just a $390,000 liability to the insurance companies. Obamacare, as a result, creates all sorts of incentives for insurance companies to avoid the sick, to mistreat them if they do enroll in their plans, and ultimately to dump them.
Well, how would they mistreat them? I mean, what would they do? Give me an example.
Well, imagine you're one of those $400,000 patients. Say you have cystic fibrosis or cancer or some very expensive condition. An insurance company can keep you from enrolling in their plan by having a very narrow network of doctors, that even if it has the doctors that the type of doctors that you want, the oncologist or the pulmonologist that you want, you have to travel long distances in order to see them. And so if they do that, then you're going to say, I'm not going to sign up for that plan, I'm going to sign up for another plan. Any insurance company that is caught providing you, the cystic fibrosis patient, the best coverage is going to go out of business, because all of those $390,000 liabilities are going to come onto their books, and they're going to have to raise their premiums. They won't be able to attract any healthy people, and they'll go out of business. So Obamacare creates a race to the bottom where insurance companies have to compete to avoid you. And we know that it's not just insurance company greed, because even if they do it by mistake, even if they just happen to underinvest in claims payment or customer service, call centers, that sort of thing, Obamacare still rewards them if they provide sick people lousy coverage.
I see. Well, I read that 10 out of the 23 innovation health insurance plans known as co-ops that were established with $3.4 billion in Obamacare loans will be out of business because of weak balance sheets. Can you comment on this?
Well, it's more like 13 or 14. The first one of these, you remember during the debate over Obamacare, a lot of supporters wanted a Medicare-like public option is what they called it. It was
Yes.
a government-run plan to compete with private insurers.
Yes.
They couldn't get that, so they created these co-ops where the government would give a lot of seed money to people who had no experience running a health insurance company, so that they could launch a health insurance launch health insurance companies in many states. And in at least one state, the plan, even though it was approved by the federal government, the plan for Vermont's co-op was rejected by regulators because it was just unsustainable. And that proved prescient because in 13 other states where plans for these co-ops were approved, they're now going out of business because they did not know how to run an insurance company. And they wasted billions of taxpayer dollars on these unsustainable models. And a lot of people now are losing their health coverage. You remember before Obamacare became law, notwithstanding the president's promise that if you like your health plan, you can keep it, 5 million or so people lost the health plans that they were satisfied with.
That made 5 million, okay.
Well, now with the failure of these co-ops, close to 1 million more people are losing their health plans, including people with very high-cost conditions who are having a hard time finding replacement plans that cover the doctors that are treating them. So this is one of the ways that Obamacare actually widens the cracks in our healthcare sector and makes healthcare access to healthcare less secure rather than more secure.
Well, that's something that the Congress needs to address in the future here. I read that half of the 10.5 million uninsured Americans who are eligible for Obamacare are between the ages of 18 and 34, and that group tends to be very healthy. How do young adult Americans, or how are they faring with Obamacare? Because isn't it cheaper for them to pay the penalty and opt out than get the insurance?
Well, these are the sort of the first victims of those price controls that we talked about before. The $5,000 patients who are seeing their premiums double, or in some instances
so they're opting out.
triple.
Yeah.
If you see your premiums go up by that much, and you know the government has passed a law that says to an insurance company they have to cover you regardless of your health condition at the same premium as anyone else of your age, that creates an enormous incentive for you not to buy health insurance until you get sick.
That's right.
Now, Obamacare's authors thought of that. They included an individual mandate that says if you don't buy insurance, you have to pay a penalty. But in many cases, the cost of the penalty
is cheaper than buying.
Yeah, it's cheaper to pay the penalty than to buy the insurance, and in fact, the amount of the penalty can be zero if you're smart, because if you make sure that you don't leave any money lying around at the IRS.
Yes.
That they owe you, that you owe
refund.
them money at the end of the year rather than them owing you a refund, then they can't come after you for that money at all. As long as you don't leave any undesignated payments at the IRS, they can't collect that penalty from you. They have no tools to do so other than to send a sternly worded letter that they'll have to follow up with another sternly worded letter, because that's all they can do. So there are incredible incentives in Obamacare for healthy people age 18 to 34 or even older just not to buy coverage and to wait until they get sick to buy coverage.
Well, how have things changed under Obamacare generally? I mean, can you just give like a broad brush answer to that? How have things really changed?
They've changed in a number of ways. One is a lot of people have gained coverage. A lot of people, almost as many people, have lost their coverage. They've either lost the health plans that they had before, or they're finding that their health plans are being canceled right now. We're seeing premiums rise faster than they did before Obamacare. If you'll remember, the president, when everyone thought that this law was dead and was not going to get through Congress, the president noticed that one insurance company for one plan increased premiums by 39%, and that was an outrageous increase.
Yeah,
according to the president. Well, now we're seeing those sorts of increases all the time in Obamacare. That's not a rarity anymore. And if that was I think if that was alarming back then what we're experiencing now should be even more alarming. This law has also done a lot to polarize our politics and pose a threat to the rule of law, because it has, I prefer to call it Obamacare right now rather than the Affordable Care Act. The Affordable Care Act is the statute that Congress passed. But what we're living under now is something different because of all the ways that the president has rewritten the law on his own, along with the Supreme Court.
Was it through executive orders? Or
sometimes through executive orders, sometimes through blog posts,
Really?
sometimes through Supreme Court decisions. In fact, in the most profound ways, it's been rewritten through Supreme Court decisions. So now we have a law that never could have passed Congress There were never the votes in
Aha.
Congress to pass Obamacare,
Interesting.
and yet we're all still living under this law as though it were legitimate.
Well, let me ask you, what would it cost to repeal the Affordable Care Act? I read it could cost $36 million to repeal it.
Well, it doesn't cost the federal government anything to repeal a law. That if they repeal Obamacare, that means they will not be spending all the trillions of dollars that Obamacare would spend. That would save the government money.
But they have to replace it with something, though. I mean, they have
Well,
to,
that depends on what the replacement is. I think that that a replacement plan would not have to increase spending. Say you repealed Obamacare and eliminated all that new spending. I think you can replace it without increasing spending above that new baseline. I think that you can find savings in the Medicare program. There's a lot of money wasted in Medicare. You can find savings in the Medicaid program to provide a safety net for those who are truly needy. But you can then change the way we spend money on healthcare. You can give the money, instead of having government and employers spend all this money, you can put that money in the hands of the consumer. Let them choose whether to buy health insurance, how much health insurance to buy, and how much of their medical care they'll pay for out of pocket. And that will transform our healthcare sector in a way that does make healthcare better and more affordable and more secure.
Interesting. Well, let's look around globally. I mean, Switzerland and Singapore, two wealthy nations, spend a fraction of what the United States does on healthcare subsidies, and yet they have achieved universal coverage with high level of access and quality. I mean, why can't the United States do as well as these countries?
Well, we have to be careful when we say universal coverage. What they've done is they've issued a government guarantee of access to health care, but that doesn't mean that everyone's getting the health care that they need. In fact, in Switzerland, what you see, that Switzerland basically has an Obamacare-like system with those government price controls, those health insurance price controls that I mentioned, and all of the perverse incentives that they create for insurance companies to deny care to the sick. And we see that happening in Switzerland. So I wouldn't say that that's universal, because you have people falling through those cracks and government making them wider rather than finding ways to fill those cracks in. In Singapore, they've got an interesting system where they have mandatory savings for health insurance. For medical expenses. So everyone has a health account that they have to save money in. And to the extent that that patients in Singapore are paying for more of their medical care out of pocket, well, that's helpful because they are more cost conscious.
Okay.
They think more carefully than probably Americans or other patients do about whether this service is really worth the money.
Okay.
But there are also problems in that country. They use price controls for medical services so that you have the same problem where government's setting the prices and it's always setting them wrong, either too high or too low.
Okay.
You end up with surpluses or gluts, and surpluses or shortages, and you're not getting health care resources to the people who need them the most. You need a functioning price system for that.
Well, describe for us a single payer government dominated system. What does single payer mean? Doesn't that mean socialized medicine?
Well, not necessarily. I think that the socialized medicine is a broader concept than just single payer. Single payer is what you might call the purest form of socialized medicine, where there's only one entity that's paying for medical care for the entire population, and that's the government.
Okay.
And so you could call the Veterans Health Administration here in the United States single payer, because the idea is that if veterans qualify for care, they can go to the VA and they don't have to pay for anything. The government employs the doctors, owns the hospitals, and so that is a totally government-run system. And they have something like that in Canada and the United Kingdom. And in those systems, we see the same thing over and over again. They may do well on certain dimensions of quality, like access to a primary care physician, but if you're sick, then you are going to wait a long time in order to access medical care.
You mean you will be waiting a long time for surgery, right? If you need,
for example, or a high-tech imaging
scan, right.
Scan like an MRI, a PET scan, a CT scan, and so a lot of people suffer, are in pain while they're waiting for care. In fact, Canada's Supreme Court several years ago ruled that the waiting lists in that country constitute a human rights violation. When coupled with the fact that Canada then tells people you can't spend your own money on healthcare outside of the government-run system because it's supposed to be a single-payer system.
Okay.
So a human rights violation doesn't really sound like universal coverage.
No, it doesn't. That's
me.
not good. That's very negative. Well, one of Obamacare's controversial provisions is its individual mandate to require most U.S. residents to purchase federally certified health insurance or pay a fine. I mean, please, I mean, is this something that the House of Representatives wants to delete in the future, you think? Or is
the House of Representatives recently passed a law that would repeal this individual mandate along with several other parts of Obamacare. And in the past, they've passed laws that would repeal Obamacare in its entirety. Those laws have never made it through the Senate. We'll see if the most recent one does. But that is the most unpopular part of this law, and that's
paying that fine
is the idea that the government can force you to buy a private product. Because if you think about it, never mind. I mean, it creates all sorts of problems in the healthcare sector, and in terms of making healthcare more expensive for people, letting government design your health insurance policy, and that forestalls a lot of innovation that could improve the quality of health insurance. But imagine if the government then took that power and tried to use it elsewhere, effectively taxing people who did not buy broccoli or other products. That's a power that could easily be abused when special interests get hold of it.
You know, most Americans obtain health insurance through their employers. I mean, how did the United States World War II economic policy start with most people expecting health insurance from their jobs?
Well, there were really two things that the federal government did to encourage employer-based health insurance. One of them was that in World War II, there were wage controls that told employers you cannot attract more workers by increasing wages. Labor was scarce because so many men were off fighting.
Yes, in World War II,
in Europe and in the Pacific. And so employers were trying to attract workers, and they said, I know, we'll offer them health benefits.
Okay, that's how it started.
So it was a result of that, plus then the government said that it would not tax health benefits the way it taxes income, which sort of tilted the playing field in favor of health benefits and away from over cash wages, because a dollar that an employer spent on your compensation would go farther if he gave it to you in health benefits.
Because he would not be taxed. The company
because it wouldn't be taxed. Right, you get a dollar's worth of wages instead of 40 or 50 or 60 cents worth of cash. I'm sorry, a dollar's worth of health benefits rather than, say, 40, 60 cents of cash wages. The problem with that is that the government decided to favor a type of health insurance that disappears when you get sick and can't work anymore.
Oh dear.
That's a terrible model of health insurance to build a health insurance market upon. So, and I think that's really instructive that 70 more years later, we still haven't leveled the playing field. The government still hasn't corrected that really original sin that it committed back in back in the 1940s. That has so distorted our health insurance markets and left a lot of people without coverage when they needed it the most. I think we would have had much more secure health insurance.
Absolutely. And then I read that the average daily cost for a hospital stay in 2012 was $4,287. 1 day in the hospital, $4,287. But in France, the same stay in a hospital would cost $855. I mean, why are U.S. hospital prices extreme?
Well, I think the biggest answer, or the main reason, is that patients in the United States are not cost conscious. We are so heavily insured because of so many government policies that encouraged us to get more coverage, including the
what
ones
about
we were just talking
physicians? I mean, are physicians cost conscious? I mean, are hospital administrators, are they cost conscious?
And the way the government subsidizes healthcare for the biggest users of healthcare, the elderly, through the Medicare program, is a way that encourages physicians to do more and more services. That pays them per service. It's called a fee-for-service payment system.
Okay.
Where not only does the government pay the physicians more the more stuff they do. But the government sets the prices for those services, and the physicians have a lot to say about how much the government will pay them.
Wow.
Because they lobby for this. So you combine the fact that patients are not cost conscious with the fact that the government encourages physicians to provide more and more care to patients and even allows them some say in how much they're paid, you have no price competition at all that would keep prices down. And when the government is able to push prices down, such as in the Medicaid program, which we talked about before, that program exists not so much for the elderly and disabled as Medicare does, but ostensibly for those with low incomes. The government pays doctors a lot less to see Medicaid patients, and that creates a problem in that a lot of Medicaid patients have a hard time finding a doctor that will accept their Medicaid
I read that.
coverage.
I read that in your book. The
Right.
fact that Medicaid is really terrible.
And it's just another illustration of the fact that government never gets the prices right when it tries to control
I'm
prices.
going to talk about the title of chapter 57 in your book. There is one executive order that could stop Obamacare. Can you elaborate on that one executive order that could stop Obamacare?
Well, first we should point out that these are really short chapters. So when you see chapter 57, people shouldn't be intimidated by that. Some of these were, very short essays of a couple hundred words. But the one you mentioned has sort of been overtaken by events. Those subsidies I mentioned before that the ACA doesn't allow, but the Obama administration was issuing anyway, and are available now under Obamacare, now that the Supreme Court has ratified them. That's what we were talking about in that chapter, that the next president, after President Obama left office, would be able to say, no, these subsidies are unlawful and we will not issue them anymore, and that would have forced Congress to reopen the law. Unfortunately, in a case that the Supreme Court ruled on in June of 2015, the Supreme Court not only ratified those subsidies that Congress never authorized, but the Supreme Court said that a future president cannot come back and undo them. So this is another one of the ways that the president and the Supreme Court got together to rewrite the ACA into Obamacare, a law that never had the votes to pass Congress.
Interesting. And also, I thought chapter 14 in your book was interesting. The title of that one is The Massachusetts Health Plan, Much Pain and Little Gain. Of course, that was the basis of Obamacare, wasn't it? The Massachusetts Health Plan?
Right.
Well, tell us a little bit about that. Why is that plan so terrible?
Well, it's almost identical to Obamacare, and so it makes health insurance, instead of filling in the cracks of our healthcare system, it actually widens them in all the sorts of ways that we've been talking about already. And the people of Massachusetts tolerated that law, including an individual mandate being imposed upon them, largely because the federal government was paying most of the cost. So taxpayers in the rest of the country were subsidizing this program in Massachusetts so that the people in Massachusetts and supporters of that plan could say, hey, this works so well with other people's money, and then use that as a rationale to impose that on the rest of the country.
Well, real quickly, can illegal immigrants access Obamacare now or in the future?
Well, there are ways that undocumented immigrants can enroll in the ACA, and there are ways that they can receive subsidies. One of them is by fraud, and that happens in government programs. Another one is that the Obama administration, and yet another example where they have expanded the law beyond the statute that Congress passed, did create a narrow way for undocumented immigrants to obtain government subsidies to purchase health insurance.
Where can our viewers in Arlington find your ebook?
They can find it on our website, which is cato.org.
Cato.org?
Yes.
Okay. And thank you so much for being with us on the Bookman's Corner. It's been a great discussion.
It was great to be here. Thank you.
And please join us again next month for a new edition of the Bookman's Corner. I'm Lois Lindstrom. Thanks for watching.